You know, April, I'm so glad that we have this opportunity to talk about the issue of malnutrition and eating disorders, because this is something that comes up for us time and time again, right? Parents and young people, they always want to know, why can't we work on the emotional stuff first? And why can't we deal with some of these cognitive distortions before we put people through this painful process of having to eat, right?
That's right. And it comes up so much. I'm thinking of, at a scenario where families are in distress and they're in hospital. The young person has a very low heart rate, and yet they're really struggling to get the medicine that they need, which is the food.
Exactly. And there's so many ways in which malnutrition impacts an individual, right? So it's not just the body, it's also the brain and all of those behaviors, and it's also the relationship. So, what we know is that we need to just work on that nutrition piece before we can actually start with the other stuff.
And I always, start by telling families that malnutrition, that the eating disorder caused, really goes from the top of the head to the tip of the toes. And because it impacts the brain, then we have the behaviors, and then that impacts the relationship. So there's just a continuum of how that malnutrition, but when they're in the hospital, the malnutrition, the pieces that really get in the way of recovery are the symptoms that come up for them. And that can be so distressing for the patient, but also for the parents.
For sure. And I think, we talked about, thinking about the body, and then maybe talking about the brain, and then talking about relationships, just to kind of break this down.
Yeah, that's right. And so, the number one question when I come in the room, because I am, supposed to have the medical expertise, they're admitted generally for their heart because their heart rates can become so low. I like to use metaphors with the family because I find that metaphors are so helpful for them to understand what's happening with the body. And so because the heart has a number, they're able to see that the heart is slowing down, and it has a number associated with it. And then I go on to tell them, well, that's what's happening in the gut and in the stomach and in the bowels. And then that helps them understand some of the overwhelming feelings they get when they're trying to refeed, things like feeling really full and bloated after eating, feeling lots of stomach pains, and often being really constipated, which can really interrupt the progress of their eating.
Yeah, that's so true, because that comes up all the time in conversation when, there's this tension around trying to support refeeding or trying to support nutrition. And then the pushback comes from, I'm bloated, I have reflux, it's so uncomfortable. And oftentimes parents and caregivers and other physicians, other people involved, will often see that as maybe behavioral, or think the patient's just sort of making that up in order to avoid eating. But what you're saying is, in fact, that this is physiological, right?
It's completely physiological, and we know that, and I often go back to the studies that were done in the 80s where they looked at these individuals and they had delayed, or their stomach was delayed in emptying up to 50 to 60% of someone who is well nourished. And so when I explain that to the individuals that are struggling with eating disorders and their families, like, oh, so it's not that the eating disorder is working to get them to avoid eating, they actually really feel these symptoms. All of these symptoms are real and physiological, and it's working together to overcome some of those symptoms so that they can progress in their treatment.
So kind of thinking from head to toe, I don't know if there was anything else that we wanted to kind of speak to from your perspective.
I think there's so many things from head to toe. I think when families are in most distress is the things that get in the way of treatment. And so I touched briefly on the heart. The heart slows down, and that impacts when the person gets up quickly or is making a lot of movement. They often get dizzy, sometimes they faint, and that can be really frightening for the caregiver. And so when families come in and we're talking about those things, those things are often thought maybe there's something going else going on with the heart, that we're missing something. And really it's a symptom of the malnutrition again, and we need to re-nourish the body to get that heart rate back up, and so that they can start functioning normally again.
I really like the way you oftentimes explain kind of how the whole gut slows down and the various symptoms. I think that's really helpful, especially that piece about how it kind of connects to a person's experience of hunger and fullness. Could you go through that?
Yeah, so I think the thing that is really important to share with families, for caregivers and individuals who are struggling with this, is that when they are in a malnourished state, everything slows down. So the emptying of their stomach can be 50 to 60% slower, and then all the movement down through their intestines, so they can get constipated, and that all sends a message back to the brain that they're full. So they get early senses of fullness. We call that, hunger and satiety messages are really confused, and so when they feel full, they want to stop eating, which is a normal kind of reaction to feeling full. And yet for a person with an eating disorder, that's too soon, and that's not going to re-nourish them. So it always feels like a battle for the families to get them to eat more, or if they're in hospital, for the people working with them. And they're really talking about being full because they are feeling that physiologically. And you can imagine that fullness for an individual suffering from an eating disorder could actually be translated as feeling fat. So that is a really scary place for them to be. Or pain, definitely it's translated, but I think pain is something they feel and sense, which is real, but the interpretation of that fullness or pain is actually you're fat and you shouldn't eat anymore. And so it's what they feel, but also the way their brain interprets that.
So it's going from a place of having lost their appetite entirely to a place where they don't know that they can trust what their body's telling them.
That's right. And oftentimes I think, when an individual is very malnourished, they're kind of numbed out to, the sensations. And then all of a sudden when we're asking them to become nourished and they're feeling all of the physical sensations, but also some of the emotional sensations are coming back online, it's just so overwhelming. And if you are not on the same page as a caregiver or a healthcare provider, you could be really resisting the recovery of that person.
And this ties totally into the effects on the brain, right?
Definitely.
Which is another big thing that we talk about a lot. A lot of people don't realize that the brain is, in fact, a part of the body. And just like the whole body is impacted by malnutrition, the brain is as well, right? So people don't often know that the brain actually shrinks in this condition, which fortunately is remediable over time. But because the brain is in this state of energy conservation, it can lead to so many changes, right? In terms of the person's experience of emotion, how they express that emotion, and how they kind of receive cues from other people. Something that I know we both experience a lot is when other providers and families, to be fair, they want to know, is this person experiencing depression? Are they experiencing anxiety? Do we have the diagnosis correct? Because through the process of kind of malnutrition, they've seen this poor kind of person become increasingly sad and distant, anxious, worried, more rigid. There's all of these symptoms that start to make it look like, oh my goodness, this person has all of these things going on.
That's right.
But what it is, right?
It's malnutrition. And I think people get to a point where they feel that term is overused, but it really is the basis of so many of the signs, the symptoms, and the inability to have healthy interpersonal relationships. And I know I do a lot of coaching with both parents and healthcare providers to get them in a place where they're able to not only understand it, but engage in a way that's helpful for the young person.
The questions I often get asked, of course, are around like this kind of diagnosis piece.
For sure.
And, do we need to make another diagnosis? I actually get that question more from healthcare providers and sometimes from families.
Right.
And it's a tricky one, right? Because it's very hard to make a diagnosis when somebody is in this place. And what I'll often say is, I'm looking a little bit more at what their history was before they became so unwell and looking at that family history. And sometimes that additional information might lead me to be a bit more suspicious that actually, yeah, I think there might be some depression going on here, aside from the eating disorder and aside from the malnutrition. But I'm really cautious about those diagnoses. I mean, I know we both are, because we know that, as somebody starts to recover, we oftentimes see a lot of those signs and symptoms changing.
And don't you find, like, what we've often talked about is that malnutrition is a great mimic of many other comorbidities, whether
Everything.
it be other mental health diagnoses or other cognitive disorders. So, you really want to have that time spent and then rehabilitation of their nutrition before you make those decisions. But I think for you, especially in psychiatry, is you often get asked, well, shouldn't we be treating this? The person is showing up and they look so depressed, or they're really anxious about eating. Oh, and that anxiety is spreading out into other areas. Dr. Jericho, why aren't you putting them on an antidepressant right now?
Right this second, yeah.
These symptoms are indicating, like diagnostically, you should be putting them on a medication. How do you respond to questions like that?
Yeah. Well, I think it's important for everybody to understand, right, that there is no medication that treats anorexia nervosa. There is not a pill for that. So that's the first thing that really needs to be understood. And I guess the next thing is to appreciate that, sometimes there are things going on in the short term that could benefit from treatment. So we're talking about that acute anxiety that can get in the way of actually eating, for example, and sleep is another big one too. So medications can be useful to treat some of those sort of features, if you like, or things that are going on that are getting in the way acutely, right? But that's very different than starting a medication to treat a whole other condition. So, in eating disorders, commonly medications are used to try to support the recovery process, but there isn't a whole lot of great evidence that this is going to make or break the situation, right? It's just a piece of the journey. And for some people, medications are merited. They can be helpful. For other people, not so much. And people need to understand too that that's a personal choice along the way. And I think that I would be much more apt to promote it if I knew for sure that that was going to be helpful for each and every person. But we just don't really have the information to say that. And I think that's where the complexity comes in, and you start looking at, well, is there something else going on here? And should I be thinking about depression or OCD kind of keeping us a bit stuck? And then we work together to sort of think about how we might want to use medications there. So I guess it's a complex answer, right? And there's no one approach.
And I guess that's where it comes down to for individuals with this disease, eating disorder, is that it's a complex biopsychosocial disease, and while we need the food as a medicine to re-nourish the body and the brain, ultimately when we get to a point where they are feeling and functioning more, then so much work needs to be done around rebuilding skills or getting skills and rebuilding relationships. And a lot of that work happens outside of hospital, and unfortunately for quite some time. So the acute impacts of malnutrition are significant, and then more long term, it's working with a more nourished brain and body for, to build more of those skills. Yeah.
And that's, again, you're kind of dovetailing into this really important piece that I think for me is maybe the biggest piece that I think I'd love people to really know more about, and it's the impact of malnutrition on the interpersonal or the social aspects of the individual. because that is such a barrier, right? It's a barrier to communication, and it's a barrier in relationships. And I don't think people always understand that some of the behaviors that we see from people who are suffering, it has to do with the fact that, again, they're in energy conservation mode. And so, for example, what we know about people when they're very ill is that they don't have like a broad range of facial expressions, right? So, there's two classic expressions. It's that kind of really blank, kind of emotionless face that we can see, or it could be a bit more of a superficial kind of pasted on expression.
Yeah, fake it till you make it kind
That's
of.
it.
Yeah.
And then, that's really hard. Like, that's hard to relate to, because as human beings, we're always looking for those cues. And when we're getting that back from someone, we can make all kinds of assumptions. And we see people making assumptions about our patients all the time, right? They're not responding, they're faking it, like they're not really wanting to engage, and sometimes that's not the case. But this is how they're showing up as a function of this illness, right? So I always think about that piece. And then, of course, their ability to read our emotions too, right?
Definitely. I think, when parents first present and the young person is so unwell, so many times they're trying to explain to me how they used to be. And so they were the top of their class, high functioning, possibly, valedictorian, top athlete, and all of those qualities and traits that made them that are still within them. Unfortunately, eating disorders also really like those qualities because it's focused, it's driven, it's strong-willed. And what I say is we don't want to take those traits away, and they will get back there, but we need to nourish that brain to be able to use those traits in a more productive, helpful way. And as they start to recover, sometimes when they start to feel their emotions, they're really emoting in ways that the families haven't been used to. So maybe they're more direct in their conversation, and that's really challenging for families as well. So it's really, walking that journey with them and normalizing that this is recovery from a malnourished brain and body, and that the relationships will build over time with that help.
Yeah, because they can't often interpret kind of what we're trying to convey either, right? Like, that's another piece that oftentimes gets in the way of sort of us wanting to be supportive, is sometimes we're really experienced as threatening, hostile, and that kind of suspiciousness is a part of the sickness too. So you're thinking somebody's feeling suspicious of me, not able to read my cues, I can't read their cues. Man, that's a serious barrier. And then outside of a hospital setting, thinking about that person in the community with their parents and with peers, it's pretty easy to understand how people with eating disorders become so isolated. And then that isolation just builds on the illness,
I think the three things I'd like to leave people with today is, number one, that food is the medicine when we are starting the recovery for someone with an eating disorder.
Absolutely, yeah. That ties into the second piece for me, which is you cannot step into the therapy until the food piece is addressed, right? So you really can't jump over that. And therapy is critically important, and all of those pieces of emotional recovery and diagnosis and treatment, yes, all of that is critical, but you can't jump into that until you've addressed the nutrition.
Definitely. And I think the third is that all of that takes patience and time.
For sure.
And if the physical piece, which is the brain and the body, is still at the starting point, and you're trying to do the psychological and relational pieces without that foundation, you're gonna have regression. And so I think we have to get that brain nourished so it can start working on some of those other things. So food is your medicine.
Yeah.
It takes time and patience, and therapy is a part of it, but it has to be the right place and time.